Hey guys, I'm here with Rasu. Do you want to give a little introduction on who the heck you are?
Absolutely, Nico. Hey, my name is Rasu Shrestha. I'm a radiologist by background. I'm the Chief Innovation Officer at UPMC and the Executive Vice President at UPMC Enterprises.
Awesome. Well, thanks for hanging out with us here today. I want to talk to you about how we're moving from this analog world. If you think 10, 20 years ago, everything's on paper, we're writing on clipboards, to a world where everything is now being entered in a digital format.
Absolutely.
How is that changing the face of healthcare, and where's it going from here?
So it's really interesting, Nico, and you and I sort of had chatted about this, and we're in this journey together in the industry, but we've moved from analog in large parts to digital. We've sort of done that, and meaningful use in the last several years has really expedited that move, right? Finally, right? So that's the one good thing about meaningful use is the adoption of health IT has gone from what, like 7-8% to like 90% through the roof. It's amazing, it's awesome. But the challenge there is we've, I think, quite blindly moved from analog to digital by replicating everything that was analog in the digital form factor.
Yep.
Right, so the files and folders and the tabs, we have e-files and e-folders and tabs.
We just put e's in front of it.
Absolutely, that's
Email.
what we did, email, right? And the culture of analog, we haven't let go of that either, right? So what we've ended up with are these file cabinets, these silos of information systems that aren't talking to each other, right? So data is held captive, it's held hostage, and I'm teeing you up because I know where you work. Nico. All right. But that is the challenge that we live in today.
Yeah.
So
we have the data, it's digital. How do we actually start to, I don't know if you heard that Joe Biden, Judy Faulkner conversation where, it's 1,000 pages, you're going to understand 10 of it. How do we actually get to a point where we can have applications who sift out the signal and that noise and actually put it in a place where patients and providers can make use of that data now that it's digital?
Sure, so signal to noise ratio, right?
Yeah.
So that's what radiologists look at all day long, right? So that's important because it's one thing to have data, so zeros and ones, that's all great, right? But it's another thing to move from data to information to knowledge, get that knowledge translated to insights by contextualizing that knowledge with the presenting symptoms of the patient who's in front of you, by the zip code that the patient lives in, by the biomarkers that so there are all of these things that you need to connect the dots across, right? So the siloed database, that is a good starting point. And that's what it is. But how do you liberate the data? How do you free the data and really go after like APIs that can bring the data to life by contextualizing the data and then getting at not just insights that would be actionable at the point of decision making for clinicians or for consumers and patients or for entrepreneurs or executives that are about to do whatever decision, but how do you make sure that you influence behavior change? I think that really is at the crux of how we can really capitalize on this data movement that we have, the digitization movement that we have, is influencing behavior change, those nudges, right, in terms of patient behavior, in terms of clinician behavior or anything else. That's what it's really about.
So I've got a bunch of ideas on the API side. We don't have to go down that rabbit hole.
I'm sure you do.
What's most exciting to you from the behavior change point of view? Like, who's out there doing really interesting things? What are you seeing at UPMC as things that's actually changing patient behavior for the better?
Oh, we are, so obviously, come on, right? So as a payer and a provider system, this yin and yang of a payer provider that we are, we truly believe that the future of healthcare, A, is going to be built on the strongest of partnerships that exist out there. And B, it's going to be built on really capitalizing on data and getting at behavior change, right? So part of what we're doing is really looking at this yin and yang of the payer provider and saying, all right, what's in the best interest of not just the patient that providers treat all day long, or the health plan member that plans cover all day long, but really the person that's at the other end, right? So that taking that person-centric approach and looking at what influences their decision-making matrix, right? And really getting at this, whether it's through really simplistic capabilities like text messaging for smoking cessation, for example, right? To more complex algorithms, and way on the other side would be AI and machine learning and pattern recognition and deep learning, neural network type capabilities. But you don't have to get all complex, right? It's really about contextualizing the data and then intervening at the right time using the right means. That's what it's about, and we're doing a lot of that.
We work with a lot of software providers who create a software solution or want to create a software solution to a lot of these problems. How does the organization, the health system, actually need to change their behavior to do that as well? Like, it can't just be software that has to do it. How do you think about the behavior change on the health system side as well?
So I think there's a big culture clash that exists in health systems, right? So clinicians, I've been taught to go with the tried and tested and evidence-based guidelines and best practices and clinical protocols. If it's worked before, do more of it. And then entrepreneurs and innovators, we come in and we say, hey, look, here's this brand new way of doing things. Trust us, it'll work, right? And no wonder there's that clash. So how do you really address that culture clash? How do you turn it on its head is something that I've been talking about and we're really pushing for at UPMC and through UPMC Enterprises. And part of how we're doing this is by leveraging principles of design thinking, for example, right? Human-centered design, where we start with empathy, but we also start with that end user first. As opposed to like going out with an RFP and deciding on a product and saying, all right, we're going to have a go live event, and that's the first time that clinician interacts with that software package. We're saying, all right, let's start with that clinician first, even before that first line of code is written, or the patient first, right? And we're able to sit down with them and really idealize and conceptualize even the problem set that we're trying to tackle before we even write a first line of code. So that's part of the sort of the solution around changing behavior and really getting at sort of the cultural issues that you're starting to talk about. But it is a big paradigm shift. I think there needs to be a mindset change in how we're looking at software design altogether.
Gotcha. Well, great. Thanks for summarizing today and chatting with us. I'm really excited to continue the discussion with you. Thanks for tuning in.
Thank you. Thanks, Nico.